Good afternoon, everybody. My names are Himoonga Mulenga, PhD student at Texila University, and I'm sharing my capstone study, which was focusing on creating a caring nursing environment at the University Teaching Hospital. This is in Zambia. Introduction. Caring is universally identified as the foundation of the nursing profession. Caring differentiates nursing from medicine or the curing management of patients. The distinction helps nurses to understand their critical role in the care delivery systems. Scholars have linked caring to charity and moral uprightness as an inherent feature. Nurses are usually challenged to realize the moral sacredness of and the honor inherent to the nursing responsibility. Napoleon recognized nursing practice as a profession rooted in humanistic ideals and directed by the curative factors and not merely focusing on mechanical task attainment. Watson and Erickson also considered love, charity, and kindness as virtues intrinsic to the concept. While Matheson advanced the need for professional knowledge as a prerequisite for caring, this is in agreement with the need for evidence-based practice as was observed by Haynes. 2013. Morman also established that nursing practice was a key determinant to patient satisfaction during their hospital stay. So if nursing service is not satisfactory, definitely patients will not be satisfied with the services that are being provided by the hospitals. Nursing practice undoubtedly stands out prominently as an important field towards patient satisfaction during their illness. The purpose of the study was to collaborate with the nurses and develop strategies aimed at identifying caring behaviors that could make as part of the norm in the selected ward at the University Teaching Hospital. The objectives of the study included conducting a team building workshop, establishing a friendly and accommodating work environment, creating an acceptable work culture in the identified ward, identify acceptable caring nursing behaviors, also clarifying behaviors perceived as unacceptable by the patients. The method included holding meetings with senior management in order to win their support in terms of human and material resources, consensus building approach based on individual nurses' understanding of the caring concept. Also, the initial workshop was held to help identify caring behaviors that were going to be adopted by everyone in the selected ward. Pre-implementation exit interviews with patients were going to be held in order to solicit non-caring behaviors as based on the patient's understanding of caring. A team building workshop was conducted in order to create team spirit and a sense of belonging for all the nurses and support staff. Ethical considerations. Permission was sought from the senior management, from the senior medical superintendent at the hospital to conduct the study in the hospital, and also to hold a consensus building meeting with the nursing staff in the identified ward. The purpose and objectives of the study were explained to the nurses during the consensus building meeting. The results: 22 nurses participated in the consensus building meeting. 20 statements were given to describe caring behaviors. 35 statements were given to describe uncaring behaviors. The team further agreed to hold further meetings aimed at detailing and conceptualizing the attributes of a winning team that was required to achieve the creation of a caring environment in the world. In agreement with the findings of many nursing theorists, caring was rooted in humanistic ideals and directed by caregivers' disposition and not mere attainment of mechanical tasks. In conclusion, caring remains the hallmark of the nursing profession. Effectiveness of caregiving is dependent on the understanding of the individual care provider's conceptualization of the concept. The project being undertaken is intended to stimulate nurses so that they develop their own understanding of caring concept and subsequently create an environment with acceptable caring attitudes.